Hi, this is Dr. Pata. I'm talking today about the Missouri's medical marijuana program and some of the information that patients need to guide themselves through the process of the Missouri's medical marijuana program. Missouri's medical marijuana program and how it works is what we'll be discussing today, and we'll also discuss the science behind marijuana on a subsequent presentation. So our clinic is really geared for patients that have severe unrelenting pain, severe chronic symptomatology, patients who are taking medications for anxiety, patients who have symptoms that they're taking anti-inflammatory drugs for, patients who are on current standard medical treatment but don't get adequate relief, or who have exhausted traditional treatment protocols and they're not getting appropriate relief. Those patients may benefit from medical cannabis. This is not recreational cannabis. It's not designed to be recreational. Our clinic offers a comprehensive patient evaluation and treatment plan after a records review and a patient visit, and we determine whether cannabis might or might not be an effective treatment option for that particular patient. And then we provide specific recommendations of what would benefit the patient. We help qualified patients navigate Missouri's medical cannabis program, which is extremely complex. We offer a full range of educational programs. We give individual counseling. We have group counseling available, including through psychologists. We have workshops, and we have online learning. So our clinic is actually a bona fide medical clinic. We don't just put up a shop and say, oh, come to us and we'll give you your certification. Missouri's program is tighter than most other state programs for medical marijuana or medical cannabis. And so it's not going to be a program that someone engages in if they want recreational medication. We provide education. We explain to patients what the different routes of ingestion are, what the correct dosing is, what the different marijuana types are, and how do they get the correct medication for their particular problem. Just as pain is extremely complex, just as patients' symptoms are extremely complex, so is medical marijuana. Medical marijuana has over 400 compounds inside of it, and we've only studied a few of them. Those compounds, based upon their concentrations and how they're presented to the patient, can have totally different effects. And so we help the patient navigate the program, and we help the patient understand these different effects and their side effects. The number one thing is that we have to have a bona fide patient relationship. There has to be a bona fide doctor-patient relationship where we are actually examining and discussing with the patient their legitimate real medical issues. The program in Missouri is much stricter than other programs. What we're going to do is help patients get far ahead of the average and establish that appropriate bona fide patient relationship with one of our compassionate physicians who knows what this medication is and how to best use it for patients so that they can improve their lives and reduce their symptoms. There are certain requirements that we have for our clinic. You must be over 21, you must be a legal resident, you must have a valid ID. We want you to read through the Missouri qualifying conditions, which I'll talk about in a few minutes. We want to make sure that before you even sign up, that you've actually got one of those conditions to support your diagnosis, that you've got information. We want you at the appointment a little bit before the appointment. We don't want you to show up and not have any proof of your qualifying condition, because if that's the case, you're going to pay a $100 fee and you're not going to get any benefit from that appointment. You have to bring your medical records from other healthcare providers, or we already have to have a copy of them. We want to make sure that we've had a chance to review those records with you and make sure that the disease processes that you've got would benefit from medical marijuana, and there isn't some other reason that could detract from you getting it, or that you might have some side effect that we're not aware of. We suggest that you come in about 15 minutes before the appointment. You can expect to be in the clinic between 45 minutes to 90 minutes. This is not a drive-through clinic. We're actually going to discuss risks and benefits. We're actually going to evaluate and make a decision. If you reschedule your appointment with less than 24 hours notice, there's a $100 fee. Same fee as if you show up and don't have the records that you're supposed to have, or if we don't have a reason to be there, or your records didn't get transmitted. We do offer a compassionate discount to military veterans. The charge for military veterans is $175, but you have to present at the time of the visit with a valid military ID card at the time of the certifying appointment. The issue with cannabis is that patients may know a lot about it, but most physicians don't really have any formal education in cannabis. They don't understand what cannabis does. They don't have an idea of the dosage protocols. They don't understand the side effects. They don't understand what different quality means. And most physicians don't understand the significant drug interactions. And these are all very important for appropriate patient care. Our physicians that work in this field have advanced training in medical marijuana related topics, and we base our decisions on the latest available science and clinical research and clinical experience. Routinely, we provide comprehensive care for complex pain, so we're used to extraordinarily difficult situations and trying to figure out why somebody has a symptom that doesn't fit an exact simple category. And for that reason, we believe that medical marijuana for some patients may be extremely beneficial. We're also dealing with patients typically that have previously been on opiates, on pain medication, and we believe that medical marijuana may reduce the amount of pain medication that patients require. We will do a thorough, comprehensive exam and history and make a decision whether we believe that if in that particular circumstance, does medical marijuana help this particular and specific patient? And if that's the case, we'll issue a certification which will allow the patient to apply for a state of Missouri medical cannabis card. As I stated before, Missouri is going to be much more strict than the average state program. It requires that bona fide physician-patient relationship with documentation. This may include blood testing, it may include urine testing, it may include other diagnostic studies, x-rays, CT scans, MRIs. It may include a personal physical exam. It might include a telemedicine exam and history. So there's a whole variety of ways that we can get to the end result, but it's a bona fide interaction. It's not a drive-through. The certifying exam cannot be billed to the insurance. The insurances are prohibited for paying for certifying exams. The documentation of good medical care and the workup prior to the certifying exam and after the certifying exam can be billed typically to insurance, but the certifying exam cannot be billed to private insurance. Patients with qualifying conditions can get medical marijuana from a dispensary once they have their card, which allows them to consume medical marijuana, or they can also grow their own medical marijuana, and there's specific regulations regarding how many plants. It's typically about 6. And you have to keep in mind that Missouri is very specific. This is not recreational and it's not casual use. Casual use and recreational is strictly prohibited, and it's a disqualifying condition for getting the card. And it's a disqualifying condition that you might lose your card even after you get it. General requirements for Missouri are that you have to be over 18. If you're a primary caregiver and you take care of other patients that need medical marijuana, you can have 3 patients that you assist with, but you have to be over 21. You have to evaluate the specific patient in person. It has to be a state licensed physician, can't be a nurse practitioner, can't be a physician assistant, and you have to be diagnosed with one of the qualifying conditions to obtain a physician certification. You apply for your medical marijuana identification card. You send in your $25 to the to the Department of Health and Human Services, and a few weeks later, you'll get your card. If you're applying for the ability to grow, you can have 6 flowering plants, and it's an additional $100 for a patient cultivation card. Once your application is approved, you get your medical marijuana ID card, and then you can purchase medical marijuana from a state licensed dispensary. That does not mean that you can have medical marijuana card and go to an unlicensed individual and get your marijuana. They're regulating this very tightly, and you have to go to a dispensary. Typically, application time is about 30 days. The physician certification, prior to you getting your application in and approved, is only valid for 30 days. So, for example, July 4, 2019 is when the first medical marijuana card certification is accepted. So if you have your exam before June 4th, 2019, it's not a valid exam. You'll have to go back, get re-examined, and get the recertification in order to apply. That certification is good for a year. So Missouri qualifying conditions are chronic conditions that can cause severe persistent pain or persistent muscle spasm. It's any medical condition normally treated with prescription medication that can lead to physical or psychological dependence. It's any terminal illness, or it's an illness that's chronic, debilitating, that in the professional judgment of a physician would benefit. And there's a whole host of them. The number one thing, though, is it's not recreational. It's not casual marijuana use. It's a specific condition to be used specifically that has a specific indication, and it's not for general use. Our cost certifying exam is $300 for the initial exam. The renewal fee is $150 annually. And keep in mind that the certifying exam and the comprehensive care are not the same. The certifying exam is different than comprehensive care. The certifying exam cannot be billed to insurance. The comprehensive care, the documentation, the workup, any telemedicine stuff that's done, that can all be billed to your insurance. But the actual certifying exam cannot be. We want you to stay safe. Once you get your medical marijuana identification card, please be safe. And it's illegal to possess medical marijuana or recreational marijuana with the card if you didn't get it from the right place. So even if you have a qualifying condition and you got the card, but it's not from a dispensary, that your marijuana, it's illegal. Or let's say that you have a qualifying condition, you didn't get a card, and you have medical and you have recreational marijuana, but you would have qualified, that's illegal. Never operate heavy equipment on marijuana. Don't transport any weapons in the same vehicle as your marijuana. So don't have marijuana, even if it's medically licensed, with an appropriate certification, and have a weapon in your vehicle. Because if you do, you expose yourself to federal charges, and that's very significant. The federal regulation and the state regulation are discordant. They're not the same. The feds still regulate marijuana. The state does not. But if you're traveling on the highway and you have a gun and you have marijuana, you're going to face some very significant issues. The regulations are not quite clear yet, so stay out of harm's way. Never transport a weapon and marijuana and you in the same vehicle. Don't get marijuana from private individuals, because we've seen a lot of unintentional overdosages where unlicensed marijuana, private individual marijuana, was contaminated with methamphetamine, crack cocaine, fentanyl, acid. We've seen tremendous amounts of side effects, and we want our patients to remain safe. Keep in mind that marijuana from a dispensary is 5 to 7 times stronger than any privately grown marijuana. So the marijuana that you may have been exposed to when you were younger is not the same marijuana that you're going to get from a dispensary. And the concentrations are completely different as in terms of the THC, the tetrahydrocannabinol, the CBD ratios, and the terpenes. And we'll be going over that in the science section of this presentation. Dispensaries are required to document the sourcing of their marijuana. They're required to test it for strength. That's not the same if you get it from an individual. Dispensaries are required to make sure that their marijuana is not contaminated with illicit substances. That's not the same as if you get it from an individual. Once you find the right dose and the right effect with a particular dispensary and a particular brand, and it works for you, don't switch brands. It doesn't make any sense. Find what works and don't switch, because when you switch, you don't know what you're getting the next time. The processing of marijuana by different dispensaries, by different individuals, can be highly variable. So that's why I recommend you stick to what works and go very, very slow in dosing. Keep in mind that edibles are much stronger than what we expect and last far longer. I have a lot of patients that use edibles and they say, hey, it didn't work in 35, 45 minutes. It didn't work in 55 minutes or 60 minutes. So I took an extra dose. And unfortunately now they're having a very significant dysphoric effect. They're having a bad trip and they end up in the emergency room, or they end up with severe anxiety, or it becomes such a bad experience that even though it worked to reduce their symptom, the bad experience, the dysphoria, keeps them from ever using it again. The thing with edibles is go very slow and don't double dose. Wait at least 60 minutes if you want to incrementally increase the amount of medication that you're taking, if you're trying to adjust a dose. Never, ever, ever share your marijuana. You will lose your medical marijuana identification card and your certification. Don't ever leave your marijuana in a place that can be accessed by children or pets. We've seen a lot of inadvertent usage of medical marijuana by children and pets. And they don't have the livers to handle the tetrahydrocannabinol and the CBD. It can cause a significant issue. If that happens, contact poison control immediately. Don't combine medical marijuana with other medications without consulting a knowledgeable physician. Very few physicians are actually knowledgeable. So be very careful on combining medications. Keep in mind that recreational or casual marijuana is strictly prohibited.